Good afternoon, everyone. Thank you so much for joining us today for an overview of our Department of Mental Health and Addiction Services budget priorities. I'm Lori Criss. I'm director here at the Ohio Department of Mental Health and Addiction Services, and I'm grateful for all of you and your participation in today's event and the help that you gave, the voice that you provided in helping us establish priorities at the state level and building this budget. Before we begin, a few housekeeping notes to make this an informative meeting for all who've joined us today. First, given the number of attendees when we have who are joining us on the call, everyone is in listen mode, except for me, to ensure that everyone can easily see and hear today's presentation. This is being recorded and it will be posted to our website for future reference. You can also turn on live caption for this briefing through the ellipses more button. It's right next to the camera button at the top bar. And choosing that option will allow you to see the live caption under language and speech. And we also know that you will have questions, so my team and I are looking forward to answering those. Please submit any of those that you have in the Teams chat. You can do that live while I'm going through the presentation. We will then answer them in the order that they come in at the end of the presentation. And if we don't have time to get to all of the questions and answers, we're certainly going to make note of them, and we will reach out to you to make sure that you get the answer to any particular question that you submit. This meeting is for the benefit of our behavioral health partners and stakeholders. So if you're a member of the media joining us today, you're welcome to listen in, but we ask that you please identify yourself in the Teams chat so that we are aware of you, and our Department of Media Relations, Eric Wandersleben, can follow up with you after this presentation and answer any questions that you may have. So on to the show. I hope that you all had the opportunity to listen to or read Governor DeWine's State of the State address last week. What a vision he has presented to the people of Ohio for what we will be continuing to build for the prevention, treatment, and recovery from mental illness and substance use disorders. I'm grateful to his commitment for helping Ohioans live to their fullest potential and to reach their God-given potential. As he has said, this is Ohio's time, and this is our time to make sure we are working together to build a healthy, hopeful Ohio and to achieve meaningful outcomes for Ohioans who are living with mental illness and substance use disorders, as well as problem gambling. Today, I'd like to review the governor's budget priorities as it relates to our agency's budget specifically. If you've read or seen the governor's State of the State, this quote may have stood out to you. I'd like to reflect on what he shared with us last week in the whole of his speech, but this quote in particular. You can see that the governor believes in the opportunity that exists for Ohioans through prevention, treatment, and recovery, and he believes in all of us and our ability to live out the vision, to get the job done and meeting the needs of our neighbors, our brothers, our sisters, our children, our families with mental illness and substance use disorder. And so the budget he introduced is focused on bold beginnings for Ohio's youngest residents, healthy people, renewed communities, thriving economy. And most of our work falls into the first two categories. But it's very foundational to the last two categories as well. The growth and vitality of our communities and economy in Ohio relies on the health of its people. And in order for our state to succeed, we need Ohioans to be at their very best. Our budget focuses on helping Ohioans thrive. And you'll see our priorities summarized here in this list, and I'll go into more detail on the following slides. First, let's take a quick glance. You can see here the priority and investments that have been made under Governor DeWine over the past two biennia and how that investment is growing in the next biennium. And you may have seen me share this image before as well, but at a glance, it really does help create the vision for our priorities: growing community capacity for Ohioans to receive prevention, treatment, and recovery supports at home and in the community, while also sustaining Ohio's hospitals for those with the most acute needs. A growing safety net of crisis services is being built beneath all of this work so that every Ohioan, wherever they are, can get timely access to the care that they need. And at the very foundation of this is a strong and supportive behavioral health workforce. Of course, our focus will always remain on the Ohioans that we serve. They are at the forefront of our planning, our collaboration, and the implementation and evaluation of everything that we do. We ask ourselves each day, are the lives of people getting better because of the decisions that we make, the resources that we support, and the efforts that we make with all of you to build the system that was promised? So what does it mean to thrive? And we really do subscribe to, rely on the national definition of recovery that's been in the works for several years now, well over a decade. And it's the hope, the belief that challenges and conditions can be overcome at the very foundation of wellness and recovery. A person's wellness and recovery is built on their strengths, on their talents, on their coping abilities, on the resources and opportunities that we create for them in the behavioral health system. There are four major dimensions of recovery and wellness. First is health. Making informed, healthy choices that support physical and emotional well-being is something that every Ohioan needs the opportunity to do. Home, having a stable and safe place to live. Purpose, engaging in meaningful daily activities such as work, school, volunteering, family caretaking, or other creative endeavors, and the independence and income and resources to fully participate in society. And then community, having relationships and social networks that provide support, friendship, love, and hope. These four dimensions must drive our efforts with prevention, treatment, and recovery. Even before the COVID-19 pandemic, mental health challenges were leading cause of disability and poor life outcomes for young people. And that was true nationally and in Ohio. And we saw that the outcomes for the experiences of youth in our state and nationally was deteriorating over the past 2 decades. We have looked at the prevalence data, as you have as well, and we know that at least 1 in 5 children between the ages of 3 and 17 in the US have reported a mental, emotional, developmental, or behavioral disorder. And so in the following slides, you'll see how the work summarized here is being pursued. So much of what we're doing to benefit youth and families in Ohio is driven by collaboration with other state agencies. You can see this through OhioMHAS and our leadership role with MRSS and supporting the workforce through the Child and Adolescent Behavioral Health Center of Excellence. You'll also see our efforts in collaboration with the Department of Education for Student Wellness and Success Fund implementation and the growth of student assistance programs and behavioral health wellness coordinators throughout the state. We're also continuing our work with the Department of Developmental Disabilities for strong families, safe communities for those youth and families affected by dual diagnosis of mental illness and developmental disabilities. And also our partnership with Jobs and Family Services and the Public Children's Service Agencies of Ohio to lift up Ohio Start and create recovery and wellness opportunities for families impacted by substance use disorder and trauma. We're also working with the governor's office to lift up the new Department of Children and Youth, which is charged with promoting the efficient and effective delivery of services to Ohio's more than 2.5 million children and families by using our resources across programs throughout state government. We'll really be working to reduce duplicative program regulations and requirements from across state government, streamline applications and eligibility, and increase overall administrative efficiency, all for better outcomes for Ohio's youth and families. Building resiliency through prevention and early identification remains a pillar priority for our department. This budget includes a significant increase in our prevention line item. We will have $23.2 million in prevention, and that includes continuing our $2.5 million investment for evidence-based prevention through the boards, $3 million for the Prevention Center of Excellence to support workforce development and resources throughout the state, and also $16 million in new investment for suicide prevention so that we can fully implement Ohio's suicide prevention strategic plan. You'll also see $43 million for early identification, and some of this is moved to the new Department of Children and Youth. You'll see $22.5 million for early childhood mental health consultation, $13 million for Ohio Start, $4.5 million for early identification partnerships with primary care and pediatric settings. And then also we have maternal depression screening and education that's invested through our block grant dollars. There are about 9 million adults in Ohio, so people over the age of 18, and using prevalence data, we know that about 600,000 Ohioans who over the age of 18 are living with, recovering from a serious mental illness. Meeting the needs of people with mental illness, building that system that was promised 60 years ago with the Mental Health Act of 1963, that's priority work for Governor DeWine and for our department and for all of us, really. Treating each person with dignity and a focus on recovery, reducing suffering for families and reducing burden for our partners in the criminal justice system. That's the goal of the work that we do, and these are the priority areas that will be growing over the next 2 years. I'll review this in more detail over the next few slides. First is the growing access to wellness and coordinated systems of care and recovery supports. Access to Wellness is the name that we're using for the multi-system adult pilot that we've implemented together over the past 2 years. We'll be increasing the resources for this, so $18 million will be dedicated to this work. We'll also continue our clubhouse expansion so that more communities across the state will have these recovery hubs for people with serious mental illness to go for connection with peers, meaningful daytime pursuits, and the opportunity to pursue education, employment, and get other needs met in a very supported, peer-driven environment. We'll also be investing $5 million in other recovery hubs like peer-run community organizations, consumer-operated services, and more. This budget makes this new investment so that people have supportive places to go to engage in activities that help lift up their recovery with people who have lived experience, shared experience, and who can provide hope as well. You'll see here that our budget provides funding to support the ongoing operations and crisis support needs of 988 for the next 2 years. Based on the actuarial study that we completed last year, we know that $46.5 million is estimated to be needed for 988 and crisis response. So that's what we proposed as we roll this budget out. The source of the funds right now is general revenue funds. And we worked with OBM to create a conservative, stable, responsible budget to identify these funds in a way that we are confident the state will be able to support 988 in a sustainable way. But we also know that there are many questions and ideas around sustainable funding for 988, and we welcome those conversations with the General Assembly and with all of our partners as we continue to move forward in planning for this most essential service. You'll also see that our budget includes $40 million for crisis services. So this is stable funding for the mental health crisis stabilization, crisis infrastructure, addiction stabilization centers, crisis flex funds, and also resources for MRSS. Here you can see that we're increasing housing options and enhancing quality. We'll invest $2 million in the Enhancing Quality grant funding and $2 million in a landlord incentive fund so that we can help the private sector create more welcoming spaces and opportunities for men and women to live independently in the community, families as well. We also have a $48 million investment in RSS, or Residential State Supplement. This funding is used to help adults with serious mental illness who meet Medicaid criteria have stable housing in the community. The rate hasn't received an increase in Ohio since 2016. It's a needed increase that will help improve the quality of supports, services, and environment for Ohioans living in these settings and benefiting from RSS. We also will continue our $10 million investment in community transition program to provide continued support that helps people with mental illness and substance use disorders successfully return to their home communities upon release from Ohio's prisons. Highlighted here is the funding of addiction treatment and drug reimbursement programs, specialty dockets, and forensic supports. I want to take a moment to highlight the important work of Ohio's 10 forensic centers in particular as we talk today. Local courts rely on the evaluations and opinions that these forensic centers provide to help ensure Ohioans involved with the criminal justice system who may be suffering from mental illness receive fair and timely access to needed legal and medical supports. The work of these centers plays an important role in protecting Ohio from the significant inpatient wait lists being experienced in other states. And this funding increase in our budget is focused on supporting the ability of these centers to provide timely evaluations to local courts and to help them address forensic workforce shortages. On the next slide, we see funding outlined here expands state hospital bed capacity, ensures patient and hospital staff safety, and alleviates the stress placed on other local systems such as courts and jails. You can see that we will be growing our state hospital capacity by more than 75 beds and the staffing and workforce costs associated with that to make sure that we have access to this inpatient care that's provided in a specialty way in our 6 regional state psychiatric hospitals. We'll also be leveraging the availability of beds at the private psychiatric hospitals. We've used the Indigent Patient Placement Fund over the past several years, and we've been able to serve 3,000 Ohioans, helping them find access in private psychiatric inpatient care. We'll be continuing this investment, and we'll be referring to it as the Hospital Access Program in the coming budget. Continuing to support our workforce is a primary priority for us here at the department. We fund several centers of excellence that act as statewide hubs to promote evidence-based practices, standards, and research, facilitate learning opportunities for our workforce, and support the contemporary practice needs and training that they need as a workforce. And this budget continues this important investment in this work to help our local communities and workforce access needed training, research, and best practices. You'll also see some additional investment for a technical assistance center as well, and continuing data work around workforce initiatives. This complements nicely the $85 million that we have in ARPA funds to help grow the behavioral health workforce over the next few years by 4,000 new workforce members. You've heard the governor speak about the importance of innovation and research to inform the system that we're building in Ohio today. We have many resources to help people with mental illness and substance use disorders, but we have to do more to identify and deliver care and treatment at a scale to comprehensively affect outcomes. This budget allows for the creation of the State of Ohio Action for Resiliency Network, the SOAR network, to develop, evaluate, and implement increasingly effective mental health and addiction prevention, treatment, and recovery strategies. This network will harness the expertise of researchers and clinicians across Ohio's academic medical centers and in community practice to get to the root causes of mental illness and addiction, uncover the biological and environmental resiliency factors related to these conditions, develop new ways of preventing and treating mental illness and addictions, and supporting people in their long-term recovery, train Ohio's behavioral health workforce in best practices, and improve outcomes for Ohio's diverse people and communities. This focus on innovation will help families across Ohio better understand what their risk factors are, how to prevent the onset of behavioral health illnesses, and what treatments are needed if they experience these illnesses. And while I've talked a lot today about mental health, we're still in the midst of an addiction crisis, and so I want to highlight some of our work here as well. We're continuing to work with all of you and in our efforts to administer the federal funds for substance use disorder prevention, treatment, and recovery. And we get quite a bit of investment through not just our block grant, but the state opiate and stimulant dollars as well. About 60% of the federal funds that come in through SOR, SOS are administered in partnership with the ADAM board. So they go directly to the boards for local needs and local priorities and how to best address the addiction crisis within those board areas. Since 2019, nearly 32,000 Ohioans have been served through the SOR grant programs. And that's about 10% of the national client base that's being served right here in Ohio through the resources that we have available, even though Ohio only has 3.5% of the US population. We're performing very well, consistently above national outcomes. I also want to highlight some of the other addiction-focused work that's underway. Some of this is funded and will continue to be funded through general revenue funds and are proposed in this budget. The first is the Maternal Opiate Medical Supports Program. That is funded through our federal dollars, and it improves maternal and fetal health outcomes by providing treatment and wraparound supports to pregnant mothers with opiate use disorders during and after pregnancy. We also will be increasing our investments to support quality recovery housing and also increasing access to medication-assisted treatment. We'll be piloting a new mobile unit with MAT in this next biennium. And our budget also provides stable funding for the addiction treatment program in Ohio's jails and prisons. And while the language for the budget has not yet been released by OBM and LSC, we wanted to preview policy updates that we're seeking in this budget as well. This budget will begin to elevate quality so that Ohioans and their loved ones can have the confidence that they will get well when they access our system of care. So you can see here the opportunities that we're creating to promote safety and well-being for people served by those services and programs and facilities regulated by our department. You can also see that we are giving more flexibility and ability to local courts and jails so that they're more fully able to use the resources available to them in ways that truly meet the needs of their local citizens. And another change that we're seeking is designed to ensure that the recovery housing that operates in Ohio is quality at every site in communities across Ohio. And so while we are just at the beginning of the process with the General Assembly, and we encourage you to remain engaged partners as the General Assembly begins its review of our proposal, we look forward to staying in touch with you as well. I will be part of a panel appearing before the Ohio House Finance Committee tomorrow at 9 a.m., along with the Departments of Medicaid, Aging, and Developmental Disabilities. You will be able to watch this testimony live on the Ohio channel. I hope that today's session was helpful to you. I know that more information will continue to be available over the coming weeks and months. I appreciate the partnership that you've given us in this work. This budget really does reflect the conversations and input from so many of you who've joined us today, and I'm proud of the priorities and goals that this budget reflects. Together, we will end suffering from mental illness and substance use disorder for all Ohioans. We do have a few minutes left to take some questions. Please continue to submit those in the chat, and I'll ask our team to share any questions that we're receiving. We're also, again, going to collect questions. If we don't have time to review them today, we're happy to walk through those with you, get back with you in another format so your questions get answered.
Good afternoon, Director. Our first question is from Luke, specifically asking about the funding levels for youth programs that are likely to move to the Department of Children and Youth. He is asking how to find those funding levels.
So I think the Blue Book has some of that detailed information. As the bill itself becomes available, you will see that in the temp law language that really does provide more clarity on how all of that's incorporated into our budget, Luke. The dollars that we are working with the governor's office in that area, and as I mentioned in the presentation, early childhood mental health specifically is going to increase in its funding. That's one that we'll be working with the governor's office to be part of the new department.
Director, the next question is about the $85 million workforce proposal, specifically how these budget funds will build from there. More specifically, curious about the funds going toward paid internships for students pursuing a degree in behavioral health and social services.
So I think we'll need to find a time to walk through in more detail and have better information available to you in print for the $85 million. We'll take a note of that. We have a strategic workforce effort underway that is engaging in the long-term strategy that we'll have for the behavioral health workforce. And the $85 million is just one piece of that. In our budget, we are really looking at supporting the workforce by making sure that training and resources are available and continuing those opportunities. We're also partnering with OBM, the Department of Medicaid, and the Department of Insurance to make sure that third-party reimbursement is supportive of a healthy workforce as well.
Director, the next question comes from Skip. I am hearing a lot about more money investment. If money helped, we would not be seeing the increases we are seeing. As I look at the data being used, I see huge issues. What is your response to these two comments?
Yeah, so I'm not sure what data you're referencing, but I will say this. As we look at the data, that we can see that there is a lot of good work that's happening in Ohio. It's just not happening everywhere yet. And so we're continuing to use data, be wise stewards of the public dollar, and to work with local communities to close those gaps where full access to care is not readily available. At the same time, we're working to make sure that we're using the most cutting edge practices or discovering those practices so that where good outcomes are not yet being achieved with what is available, we can make sure that we're putting those best practices in place like the rest of healthcare does with their continuous investment and developing new ways of helping people get well and stay well.
Our next question comes from Lisa, and she asks, will there be any allocation of funds specific for alcohol use disorder? AUD funding is ending, and we, as providers, are seeing a large increase in AUD clients.
So we are looking at how we can best support continued resources for alcohol use disorder. It's not part of the GRF proposal that we have here today.
Our next question is related to raising Medicaid reimbursement rate. If we don't value the profession with a better wage, we will never be able to solve these problems.
So I appreciate the comment, and I'll just reiterate that we are working with OBM, the Department of Medicaid, and the Department of Insurance to look at third-party reimbursement for behavioral health providers.
Director, we have a question from Diane. Where will the expanded state hospital capacity beds be located?
So we are building a new hospital in Central Ohio that will be opening this summer, and that hospital will have additional capacity in it. I'm sorry, the exact number of new beds, I want to say 56, but someone will correct me if I got that number wrong. We're also working to look at our existing hospitals and make any capacity that is currently unused more available. We know that we have some capacity here in Central Ohio with our high security hospital to make some capacity available there. And we're looking at other parts of the state as well.
Director, I think we have time for one more question. When do you expect the crisis task force recommendations to be released? And do you foresee the budget to address some of the recommendations?
The report itself, we're working to create not just the release of that report, but a clear vision for next strategies with that. And so that will be in the coming weeks. This budget and the resources available here will help to be braided into the other resources that are available to continue lifting up the full crisis continuum. And that includes the dollars that were most recently allocated by the General Assembly during the end of the last General Assembly in December to help build some additional capacity for crisis stabilization, mobile crisis, behavioral health urgent cares around the state. Is that the last one for today?
Yes.
Very good. Thank you so much, Bree. That was the voice of Bree Austin, everyone. She's a new legislative team member here, and she's a great person to stay in touch with. She was one of the folks listed in the email, so thanks, Bree, for your help there. So much more to come. I'll be testifying tomorrow in Finance, House Finance Committee. There will be a follow-up in the House Subcommittee on Health and Human Services that goes into a lot more detail, I'm sure, in a more focused way on our budget. And of course, we'll be staying in touch with all of you over the next 5 months as we work together to get this budget passed and the good work underway in the next biennium. Thanks for your time and attention today. We appreciate you.